And we live. Super live. Hey y'all, hey. Okay. All right. So, welcome. Happy Thursday. Happy Thursday. It is NCLEX Thursday as usual. Welcome, welcome, welcome. Today we are doing our free 1 hour NCLEX review. Okay, so if you guys don't know me, hello, my name is Nurse, I almost didn't know my name. My name is Nurse Sam, at the Nurse Sam on Instagram, on Facebook. I am Nurse Sam on Twitter, at the Nurse Sam, thenursesam.com for my website. I help nursing students survive and thrive in nursing school, pass NCLEX, pass their nursing school exams to become the great nurses that I know you guys can be. I also help aspiring nurses pass the TEAS, HESI, or whatever entrance exam so they can go ahead and start their nursing school journey. All right, so in a nutshell, I am here to assist you in your nursing school journey from start to finish, okay? So with today, the purpose of today is for everyone that's preparing for the NCLEX. Whether that's NCLEX PN, Practical Nursing, or NCLEX RN, Registered Nursing, we are going to do a joint review, okay? Now, as far as the difference between NCLEX RN and NCLEX PN, we are going to focus on the non-scope specific stuff. So nothing leadership, basically. So all your Med-Surg stuff, all your dosage calculations, your lab values, your meds, the things that won't change whether or not you are an RN, practical nurse, nurse practitioner, cheerleader. Those things are not going to change. So that's the stuff that we're going to review today. All right, we're going to go over our methods. We're going to use our same method. Hold on. Won't be able to lose this. Okay, I think we're back. Okay, great. Making sure you guys can hear me. All right, now we're back. All right, so like I said, for today, we're going to be going over our NCLEX comprehensive review. So I'm going to be reading off the questions and the answers, and you guys are going to answer them in the comments, okay? So we're going to give it about a minute, just like you would normally if you were taking the NCLEX exam. I don't normally like to stress the time, but in a sense you have to. I know a lot of people suffer from test anxiety, so a lot of the methods that I use, I suffer from test anxiety too. So a lot of the methods that I use are used to try to decrease that anxiety whenever you're having your test. And sometimes if you're thinking about the time that's going, and you go over that time even a second, it's going to throw you off all the time. So I like to not have you I like to have you time yourself, but not look at the time. I want you to be able to actually, like your body, be able to tell when it's time to go on to the next question. I want it to be a natural thing. So that's why we repeat our questions and repeatedly expose ourselves to the information, which is why we do NCLEX Thursdays and TEAS Tuesdays. All right, so let's go ahead and get started. We are doing adult Med-Surg, adult health Med-Surg, and we're also doing like skills. All right, so let's go ahead and get started. Like I said, I'm going to read the question, I'm going to read the answer choices, and you guys are going to answer in the comments. Okay, if you guys have any questions, please put them down below. We also go through the rationale and try to figure out why we got those answers right and or wrong, so that next time we get exposed to that information, we know how to answer it for next time. Okay, we're also going to go over those rationales and try to come up with ways to like interactive and for like fun mnemonics and other ways to remember certain study material. So that's one of the benefits of being here on NCLEX Jeopardy Thursdays, because we are doing a big interactive review. It's basically what it is, a big study group on Thursdays, all right? So first question. A staff nurse is precepting a new graduate nurse, and the new graduate is assigned to care for a client with chronic pain. Which statement, if made by the new graduate nurse, indicates the need for further teaching regarding pain management? All right, I'm going to read the answer choices, then I'm going to read everything else all over again. All right, so answer choices. We have A, I will be sure to ask my client what his pain level is on a scale of 0 to 10. B, I know that I should follow up after giving medication to make sure it is effective. C, I will be sure to cue in to any indicators that the client may be exaggerating their pain. I don't know if I went between numbers and letters. But D, I know that pain in the older client might manifest as sleep disturbances or depression. All right, so I'm going to read the question again. A staff nurse is precepting a new graduate nurse, and the new graduate is assigned to care for a client with chronic pain. Which statement, if made by the new graduate nurse, indicates the need for further teaching regarding pain management? Is it A, I will be sure to ask my client what his pain level is on a scale of 0 to 10? Is it B, I know that I should follow up after giving medication to make sure it is effective? Is it C, I will be sure to cue in to any indicators that the client may be exaggerating their pain? Or D, I know that pain in the older client might manifest as sleep disturbances or depression. All right, so I am seeing some answers, and it looks like a lot of you guys are saying C, which was, I will be sure to cue in any indicators the client may be exaggerating their pain. All right, so I see somebody else that has another answer. Someone says D. All right, so let's go ahead and break this question down. So what is the question asking? Remember, we're going to break it down in 3 steps. What is the question asking? What is our problem? And then what is our solution? So what is the question asking? It's asking us for which statement, if made by the new graduate nurse, indicates the need for further teaching regarding pain management. So right there, that phrase, the need for further teaching, that lets you know that you're looking for the wrong answer. Okay, you're looking for something that you normally wouldn't want them to do. Okay, you're looking for the incorrect actions or the incorrect statements. All right, so you want to make sure that you have that in your brain, because like I said before, by default, whenever you're looking for answers and answering a question, you're looking for the correct answer to that question. So for these types of questions, you almost have to like work against your mind and make sure that your brain doesn't automatically shift back to, oh, I'm looking for the correct answer. Because in this question, you're looking for the incorrect answer. And this is how a lot of people get these questions wrong, because they're so used to looking for the correct answer when this question is specifically asking for the incorrect. So, all right, so once again, the question is asking us for statements made by the new graduate nurse that lets us know that they need further teaching regarding pain management. We're looking for incorrect statements made by them. The problem is that they have been assigned to care for a patient that has chronic pain. All right, so that's why we're assessing their teaching regarding that pain control and pain management. So the answer C says, I will be sure to cue in any indicators that the client may be exaggerating their pain. All right, and C was the correct answer. So great job to everyone that said C. Let's go ahead and look. All right. XO, Ivana, Dejon Desiree, Aja, Unknown Beauty, B Jane. Awesome job, guys. All right. So like I said, if you chose any other answer, A, B, or D, those were the correct answers. So those are the things that the client, those are statements that would not need further teaching. But remember, we're looking for statements that do need further teaching. So we're looking for statements that are the wrong thing to say. And at this point, in this problem number, letter C was the correct answer. I will be sure to cue in any indicators that the client may be exaggerating their pain. So rationale says that pain is a highly individual experience, and the new graduate nurse should not assume that the client is exaggerating his pain. Rather, the nurse should frequently assess the pain and intervene accordingly through the use of both non-pharmacological and pharmacological interventions. All right, the nurse should assess pain using a number-based scale, so like 0 to 10, or a picture-based scale for clients who cannot verbally describe their pain to rate the degree of pain. Okay, that's when you have the smiley faces and it's like smiles, no tears, smile, frown, no tears, that stuff. Obviously they can't say it, they just point to it because they cannot verbally describe their pain. It says the nurse should follow up with the client after giving medication to ensure that the medication is effective in managing that pain. pain experienced by the older client may be manifested differently than pain experienced by clients in other age groups. All right, they may have sleep disturbances, changes in gait, mobility, decreased socialization, and depression. All right, so the nurse should be aware of all these different factors when it comes to pain. All right, how we control pain, the correct measures of how we assess pain. The number one thing is to know that pain is, like I said, it's an individual experience. Pain is subjective. So if your client says their pain is 10 out of 10, you have to document, and that's what they say, so you have to take it as Bible. Their pain is 10 out of 10. You can't tell them what they're feeling. So when it comes to pain, that specific vital sign is very subjective. So be looking for cues that someone's exaggerating their pain is not is not what you want to do. All right, it's not the correct way to assess pain, especially because, like I said, it's subjective. All right, so great job, guys. Now let's go to another one. All right, the nurse is providing care for a client with a recent transverse colostomy. Which observation requires immediate notification of the primary healthcare provider? A, stoma is beefy, red, and shiny. B, purple discoloration of the stoma. C, skin excoriation around the stoma. Or D, semi-formed stool noted in the ostomy pouch. All right, I'm gonna read that question again. All right, if you guys are just coming in, I'm gonna reorient the room. Welcome to NCLEX Jeopardy Thursdays. We are doing our free NCLEX review. I am Nurse Sam. I help nursing students survive and thrive from the beginning of nursing school all the way until they pass NCLEX and get their license and become amazing nurses. So right now, like I said, we are doing our NCLEX review for both LPN and RN, because I know someone's gonna ask. I'm gonna read the question again. The nurse is providing care for a client with a recent transverse colostomy. Which observation requires immediate notification of the primary healthcare provider? All right, is it A, stoma is beefy, red, and shiny? B, purple discoloration of the stoma? C, skin excoriation around the stoma? D, semi-formed stool noted in the ostomy pouch? All right, so I'm getting a lot of B's, but I'm gonna give you guys some more time to answer. All right, so once again, we're gonna break this question down before we officially answer it. What is the question asking us? All right, it's asking us for the observation that requires immediate notification. So we know that whenever we look at something, whenever we have to report something immediately to the primary healthcare provider, we know something is super wrong. There's a complication pending or happening actively, and it is now above our control, above the LPN scope, above the RN scope. Now we have to report it to the healthcare provider. All right, so what complication regarding the problem is we're caring for a client that had a recent transverse colostomy? All right, so what complication surrounding recent transverse colostomies will we be looking out for? All right, so when you get these types of questions, you have to weed out what's normal versus what's abnormal / a complication. So all the other three answers is going to be something that's like normal or to be expected, and then that one answer, and that correct answer, is going to be something that's a complication that is not normal and needs immediate attention. So in this question, the answer is B, which is purple discoloration of the stoma. A lot of you guys got that one. Awesome job. So we're gonna go Chris, Ivana, Dejon Desiree, Colette, Unknown Beauty, Destiny, Callie. Destiny Harvin said A is normal. You are correct. A is normal. And then his queen said we'll be starting up in school. I'm so hyped for it. I'm hyped for you too. All right, so great job everyone that said B. The correct answer was B. So purple discoloration of the stoma, that is abnormal. Rationale says ischemia of the stoma would be associated with a dusky or bluish or purple color. All right, that means a lack of oxygen flow, lack of blood. We know blood carries oxygen, so if it's lack of blood flow, it's a lack of oxygen flow. But that's going to turn it that, purplish, bluish color that indicates a lack of oxygenation. So that's what that purple discoloration is going to mean, that ischemia of the stoma, which is not good. All right, that beefy, red, and shiny stoma, that's normal and to be expected. That's usually always how they describe a normal stoma, beefy, red, and shiny. Beefy, red, and shiny. I don't know what it is about that beefy red. It can't be porky red. It can't be turkey red. It has to be beefy red. That even makes sense. All right, so it says skin excoriation needs to be addressed and treated, but does not require as immediate attention as the purple discoloration of the stoma. And then the semi-formed stool, once again, is a normal finding. All right. So, great job, guys. That purple discoloration means there's a lack of oxygen and blood flow. We know that's not good. Immediate reporting. All right, great job. Next question. All right. The nurse is caring for a client hospitalized with acute exacerbation of chronic obstructive pulmonary disease, COPD. Which findings would the nurse expect to note on assessment of this client? And this is a select all to apply question. We always say that select all to apply is just one letter away from Satan, SATA. All it's missing is that N, because Lord knows. We all hate these select all to apply questions. And why? It's because it's usually about 5 or 6 questions. It's always more than 4. It's usually 5 or 6 questions, and the thing about select all that applies is that you literally have to select all that apply. So it's going to be usually more than one answer, but the tricky thing about select all that apply is that even though you have 5 or 6 questions, it still can be as little as one correct answer or as many as all correct. Okay, so don't try to trick the system and being like, okay, so I know it's select all that apply, so I know it needs to be at least 2 right. No, ma'am, can't do it that way. This is really going to assess your knowledge, because you won't be able to, eliminate based off of, okay, I know 1 has to be right, blah, blah, blah. You have to eliminate based off of what really does not make sense and what doesn't apply to the question. All right, so with that being said and noted about select all that apply, I'm going to read that question one more time and then the answer choices. So, the nurse is caring for a client hospitalized with an acute exacerbation of COPD, chronic obstructive pulmonary disease. Which findings would the nurse expect to note on assessment of this client? Select all that apply. Is it 1, a low arterial PCO2 level or a low arterial carbon dioxide level? 2, a hyperinflated chest noted on the chest x-ray? 3, decreased oxygen saturation with mild exercise. 4, a widened diaphragm noted on the chest x-ray. Or 5, pulmonary function tests that demonstrate increased vital capacity. All right, so let's go ahead and break this down. All right, so the question's asking us for findings that the nurse would expect to note on assessment of this client. All right, so we're looking for expected findings. All right, our problem, our situation is that we're caring for a client who was having an acute exacerbation of COPD. Okay, so putting that all together, we're looking for normal and expected findings for a patient that has COPD. All right, so going through it, 1, a low arterial carbon dioxide level or PCO2 level. Is that normal? Is that to be expected or not? 2, a hyperinflated chest noted on the chest x-ray. Is that something that's normal with COPD? 3, decreased oxygen saturation with mild exercise. Is that normal with an exacerbation of COPD? 4, a widened diaphragm noted on the chest x-ray. Is that normal? And then 5 is a pulmonary function test that demonstrate increased vital capacity. All right, so what are you guys thinking? I'm seeing lots of like 1, 3, 4s. Let's look and see. All right, so the correct answer is actually B and C, or 2 and 3, depending on how you wrote it. So it's either 2 and 3 or B and C. Those are the correct answers. Let's see. Anybody got that? Nobody got that one, but that's okay. Let's go ahead and go through it. So the correct answers, like I said, was a hyperinflated chest noted on chest x-ray, and decreased oxygen saturation with mild exercise. Those are going to be the findings that the nurse would expect to know on assessment of this client. One was a low arterial PCO2 level. All right, let's go through. So as far as rationale, yes, thank you, Wooey. So Wooey, she just passed. Okay. Was that today or yesterday, love? I can't remember if it was today or yesterday. But yes, Wooey is another wonderful success story. I'm so proud of you. Okay, so make sure you join Wooey. All right. She just took her NCLEX and passed that thing. She has been a loyal watcher and subscriber of the Nurse Sam and NCLEX Jeopardy. So awesome job. Results. So rationale, it says clinical manifestations of COPD include hypoxemia, hypercapnia. So hypoxemia is low oxygen in the blood. Hypercapnia is increased carbon dioxide in the blood, and dyspnea on exertion and at rest. The oxygen desaturation with exercise, that's also going to be a clinical manifestation. And then the use of accessory muscles of respiration. All right, it says chest x-rays reveal a hyperinflated chest, which was one of the correct answers, and a flattened diaphragm. All right, so that a 4 was a widened diaphragm, and it's actually a flattened diaphragm that's noted on the chest x-ray. Pulmonary function test will demonstrate decreased vital capacity, so make sure you kind of note these. All right, so once again, the for COPD, all right, you're going to have a high arterial PCO2 level, not a low PCO2 level. Remember, that carbon dioxide is going to be increased. So you're going to have hypercapnia, which is increased carbon dioxide in the blood. And then you're going to have hypoxemia, which is low oxygen in the blood. All right, so low oxygen, high carbon dioxide when it comes to COPD. All right, so great job, guys. Yay. Congratulations again. All right, guys, so once again, 2 and 3 were the correct answers. And we just went over that one. So if you didn't get that one, that is okay. We just went through why we missed those, and it's because a lot of us mixed up the oxygen and the carbon dioxide. So that's okay. Note it for now. That's why we mess up now on Thursdays with Nurse Sam, so that when it comes to our test date, we good. Okay? All right, next question. The nurse is assessing the respiratory status of a client who has suffered a fractured rib. The nurse should expect to note which finding. Is it 1, slow, deep respirations. 2, rapid, deep respirations. 3, paradoxical respirations. Or 4, pain, especially with inspiration. All right. Question again. The nurse is assessing the respiratory status of a client who has suffered a fractured rib. The nurse should expect to know which finding. Is it 1, slow, deep respirations. 2, rapid, deep respirations. 3, paradoxical respirations. Or 4, pain, especially with inspiration. So I'm seeing a lot of like 4s and Ds popping up, which is pain, especially with inspiration. Let's look and see. And that's correct. Awesome job, guys. All right, so let's see who got that. Unknown Beauty, A Better Me, OMG, it's Vicky, Kiefer, B. Kwan, Asia, and Ivana. Great job, guys. All right, so that answer was pain, especially with inspiration. All right, so breaking down that question, what is the question asking us? It's asking us that to expect to know which findings. All right, so we're looking for expected findings. Now, what are we looking for expected findings of? We are taking care of a client who is suffering from a fractured rib. All right, so putting it all together, we are trying to look for findings that are expected to be seen in the client with a fractured rib. So I don't know about you guys, but whenever I hear fractured rib, the word pain just pain just pops up into my head, because boy, trying to breathe with a fractured rib is one of the like main like nurse educations, whatever, as far as like fractured rib, because there's really nothing you can do about the actual fractured rib. You just have to let it heal, but it's a painful healing process. So a lot of our teachings are going to be about how to make that client more comfortable. But let's go ahead and get it back into the question. So like I said, 4 was the correct answer. It says pain, especially with inspiration. Rationale. It says rib fractures result from a blunt injury or a fall. Typical signs and symptoms include pain and tenderness localized at the fracture site that is exacerbated by inspiration or breathing in, and palpation, or someone touching it and palpating it. Shallow respirations. Our first 2 answers were like slow and rapid deep respirations, which is why those were wrong, because we have shallow respirations. Remember, they have pain when they're breathing in. So just think about if you had, if you ever had like gas, or like, I don't know if you ever had a fractured rib, but just pain in this area at all. Breathing in and trying to take a good, deep breath, especially when trying to do so hurts, you're not going to be able to fully expand your lungs. You're not going to be able to take a deep breath because it hurts. So your breaths are going to be shallow because you're trying to still, breathe, but still not be in pain. So that's your body compensating for the pain and still trying to get oxygen, adequate oxygenation. All right, so you're going to have shallow respirations, and then also splinting or guarding the chest to protect and minimize that chest movement. Like I said, every time that chest moves, it hurts. So lots of the teachings are going to be directed towards how to properly splint or guard that area so that discomfort is minimalized. And then it's also going to be possible bruising at the fracture site. Remember, it's caused by blunt force trauma or a fall, and that's usually going to be manifested in a bruise, hematoma, purplish discoloration. I don't know why I'm going right here. These are my ribs, but for some reason I just feel like I fell right here, so I'm just like highlighting this specific area. All right, and as far as paradoxical respirations, all right, those are seen with flail chest. Did anybody catch that? I'm glad I didn't see anybody choose 3 as an answer, but just in case you didn't know what paradoxical respirations were, those are seen in flail chest, okay? So once again, fractured rib, what are your big takeaways? It hurts when you breathe in, and we're gonna try to splint and guard the chest to minimize chest movement. And we're typically gonna see pain, swelling, maybe some bruising at that site, okay? So Madison said, how can I rewatch this later? I'm going to have the replay up on my YouTube, hopefully by tomorrow. I may have studied too much today and I missed some of it, I think. I kept checking some of my studies. Yeah, I went live at like 7:05 or something like that. That's when it actually connected. But yeah, I will have this replay up for review. All right, so great job for that one. Let's do another question. All right, this is another Satan question. Select all that apply question, however you want to say it. All right, the nurse is preparing a teaching plan for a client who had a cataract extraction with intraocular implantation. Which home care measures should the nurse include in the plan? Select all that apply. You test in 6 days, Madison? Woo, I'm gonna pray for you. You will, if you look for my YouTube, you probably won't be able to see it. The videos aren't active yet. They're going to be active tomorrow. All right, so once again, I'll read that question one more again. The nurse is preparing a teaching plan for a client who had cataract extraction with intraocular implantation. So which home care measures should the nurse include in the plan? Select all that apply. All right, so number 1 says avoid activities that require bending over. 2, contact the surgeon if eye scratchiness occurs. 3, take acetaminophen for minor eye discomfort. 4, expect episodes of sudden severe pain in the eye. 5, place an eye shield on the surgical eye at bedtime. Or 6, contact the surgeon if a decrease in visual acuity occurs. All right, so breaking that down. Questions asking for which home care measures should the nurse, aka us, should we include in the care plan? All right, the teaching plan. All right, the problem is that we have a client that we're taking care of that just had a cataract extraction with an intraocular implantation. All right, so they had an implant. Awesome. All right, so once again, putting that together, we're looking for home care measures, all right, that we're going to be teaching this client who just had cataract surgery with an intraocular implant. All right, so which ones are we going to include? We're looking for the correct things to do, so we're going by our default. And this is select all that apply. So and this is 6 answer choices. So it can be as little as one of these answers and as many as all 6 of these answers. All right, so 1 says avoid activities that require bending over. All right, bending over, think about it. Think about cataract extraction, especially with intraocular implantation. You want to think about what vital signs and what measurements. Okay, intraocular, the pressure, all right? Intracranial pressure. You do not want to increase that at all, okay? All right. So 1 was avoid activities that require bending over. 2, contact the surgeon if eye scratchiness occurs. 3, take acetaminophen for minor eye discomfort. 4, expect episodes of sudden severe pain in the eye. 5, place an eye shield on the surgical eye at bedtime. And then 6, contact the surgeon if there's a decrease in visual acuity. All right. So what are our answer choices? All right, Unknown Beauty and Kiefer. All right. So in Age's World. Great job. Awesome job. All right, so the correct answers were 1, 3, 5, and 6. And so many of you guys got that. So great job. All right. Unknown Beauty, Kiefer, Age's World, Madison, Alicia, Ivana, you almost had it. You included 4, but 4 is not in there. You had 1, 3, 5, and 6. So you were so close. All right. So just know that for next time, if you see this question again, you chose expect episodes of sudden severe pain in the eye, and that's not expected finding. They shouldn't have those sudden severe pains. So everything else was right except for that one. But everybody else, great job. So let's go ahead and go into that rationale. So following eye surgery, all right, some scratchiness and some mild eye discomfort may occur, okay? especially in the operative eye. But that's usually relieved with like mild analgesics such as acetaminophen. I'm glad they didn't say NSAID because we hate NSAIDs, right? All right, so a mild analgesic such as acetaminophen for minor eye discomfort. That's something that's appropriate, and we can include that in our teaching plan. If the eye pain becomes severe, all right, this was at number 4. If the eye pain becomes severe, the client should notify the surgeon because this may indicate hemorrhage, infection, or like I was saying before, increased intraocular pressure. I think I said intracranial, but I meant to say intraocular. All right. So once again, anytime that eye pain, like mild eye pain, mild discomfort is normal. That's to be expected. But if that becomes severe, all right, that can indicate once again hemorrhage, infection, or increased intraocular pressure. All right. When you're thinking about increased intraocular pressure, increased whatever pressure, I think about what happens if you fill a balloon up too much. All right. I don't have anything on NSAIDs, but that's going to change real soon. You may find some stuff on NSAIDs in the pharmacology packet, like drug cards and stuff. But a specific one about NSAIDs, I actually have to make a study kit on that because I want to definitely explain about NSAIDs separately. But yes, the nurse also would instruct the client to notify the surgeon of increased purulent drainage, increased redness, or any decrease in visual acuity. All these are complications. All these can be indications of hemorrhage, infection, something bad going on. All these are bad things. You must report any of these findings to your surgeon so they can try to figure out what's going on and course correct. All right, the client is instructed to place an eye shield over the operative eye at bedtime. All right, the eye shield protects the eye from injury during sleep, and also as far as the avoiding activities that increase intraocular pressure. So that's why I was saying that in the beginning. One of the activities that can increase intraocular pressure is bending down. That's one of the main ones. Bending down will increase that intraocular pressure, and that's how we get that severe eye pain, and that's how we get complications. So you don't want to do any type of action that would increase intraocular pressure, such as bending down. All right, so that's something that you definitely would want to mention to that client because, bending down, that's something that we do every day. Remember, this is home care teaching, so you want to make sure that you're hitting things that they would normally be like they would normally do or normally think or not think to do or not think about just because it's so normal to their everyday life. But you want to make sure that you're having these teachings and really educating them on how they need to adjust their home life for the recovery period, however long that is, to make sure that they don't put themselves in a worse position because of whatever originating injury. All right, so great job on that one. All right, next question. Oh, this is a good one. Okay. A client with a fractured femur experiences sudden dyspnea, tachypnea, and tachycardia. A set of ABG tests or arterial blood gas tests reveals the following: a pH of 7.35, a PaCO2 level of 43, a PaO2 level of 58, an HCO3 level of 23. The nurse interprets that the client probably has experienced fat embolus because of the result of which parameter? Is it A, the pH, B, the PaO2, 3, the HCO3 or bicarb, or 4, the PaCO2 or carbon dioxide? All right. We're trying to figure out, based on the ABG results that I just read, which of those parameters would hint to the nurse that the client is probably experiencing fat emboli syndrome or fat embolus. All right, because of which parameter? Now I'm going to read the parameters of the ABG results. Remember, the client had a fractured femur and is experiencing sudden dyspnea, tachypnea, and tachycardia. All right, so they're having difficulty breathing. They're breathing fast because they're trying to compensate for the fact that they can't breathe, and their heart is beating fast. All right, now our ABG results, we had a pH level of 7.35. We had a carbon dioxide level of 43. We had an O2 or PaO2 level of 58. We had a bicarb or HCO3 level of 23. Now, of those results and of those parameters, pH, PaO2, HCO3, or PaCO2, which of those results or which of those parameters will let the nurse interpret that the client is probably experiencing fat embolism? All right, so I'm seeing a bunch of PaO2s, which is number 2, and that is correct. Awesome job, guys. All right, so let's see who got that one. Some Call Me Boo, Kiefer, Lovely Juliana, Alicia, Prigda Safari, and Bequan. Awesome job, guys. So that is the correct answer. The PaO2, that is going to be the parameter that indicates that there's like a fat embolism or fat emboli going on. All right, so a significant feature of fat embolism is a significant degree of hypoxemia. All right, which is probably why you guys got that answer. All right, in the parameters, we had a PA2 level of 58. All right, and in fat emboli, that PA2 level is often less than 60, and in this case, it was 58. So the data in this question indicates that the items in the remaining options are normal blood gas results. So the pH was normal, the HCO2 was normal, and the PCAO2, those were normal. So the O2 was the only one that was abnormal, and 2, like we said, a significant feature of trying to diagnose trying to assess whether or not a patient is suffering from a fat emboli is to look at their oxygen level. All right, because severe hypoxemia or low oxygen in the blood, once again, you want to think about it. Fat emboli, what does that do? It goes and it occludes that blood vessel and cuts off blood supply, blood flow. And you know, if there's no blood flow, there's no oxygen supply. So we're going to expect to see a low amount of oxygen. All right, so great job. That one was a good one. All right, next one. Great job, guys. All right, next question. The nurse is planning to teach the client with below-the-knee amputation about care to prevent skin breakdown. Which point should the nurse include in developing the teaching plan? Is it A, the residual limb is washed gently and dried every other day? Is it B, or 2, the socket of the prosthesis must be dried carefully before it is used? Is it C, a residual limb sock must be worn at all times and changed twice a week? Or is it 4, the sock of the prosthesis is washed with the harsh bactericidal agent daily? All right, so breaking that down, what's that question asking us? It's asking us for the teaching to include, it's asking us for the teaching to include. Who are we providing that teaching to? Our problem or a situation that we have a client that has a below the knee amputation. Okay, now with that client with the below the knee amputation, we are specifically trying to teach them about ways to prevent skin breakdown. So that's what the question is asking us. How can we prevent skin breakdown, specifically in a patient with a below the knee amputation? One says the residual limb is washed gently and dried every other day. 2 says the socket of the prosthesis must be dried carefully before it is used. 3 says a residual limb sock must be worn at all times and changed twice a week. And then 4 says the socket of the prosthesis is washed with a harsh bactericidal agent daily. All right, let me look and see. Alicia said 3, Simply says 2, Ivana says 2, December remember says 2 or 4. Asia says 2. All right, so 2, and that is correct. Awesome job, guys. All right, so let's see who got it. All right, Alicia, I see that you changed your answer back to 2, so great job, Alicia, Simply Shayla, Ivana, a December to remember, Ages World, Naturally Cam, Mind 24/7. Amen. Prigda. Okay, great job. So yes, 2, the socket of the prosthesis must be dried carefully before it is used. This is going to be a teaching that is going to help prevent skin breakdown. All right, now let's go to rationale. So that residual limb sock, that must be worn at all times to absorb perspiration, and that is changed daily. All right, so 1 and 3, the first parts of the question of the answers were right. Like the residual limb is washed gently, residual limb sock must be worn at all times. That part is true. However, the timing was wrong. It needs to be changed daily, and the answer choices that were given to us was like every other day, twice a week. No, ma'am. We wash it every day. Okay, it's daily. And then it says, now that's for the residual limb sock. All right, the residual limb sock. So that's a sock. Just think about it. It's a sock. You must wear the sock daily because it's going to absorb that perspiration. But you got to wash it daily because it's absorbing perspiration. It's going to stink. So think about that. All right, now the residual limb is washed, dried, and inspected for breakdown twice each day. Okay, not daily, not every other day, not every Tuesday, twice daily. Okay, yes, not stink, but stank, girl. The socket of the prosthesis is cleansed with a mild detergent, not a harsh bactericidal agent. All right, it's going to be cleansed with a mild detergent and rinsed and dried carefully each day. Okay, so once again, our takeaways: residual limb. All right, the limb needs to be washed, dried, and inspected for skin breakdown twice daily. Do it in the morning, do it in the afternoon, twice daily. Okay, now the residual limb sock, so the covering for that limb. All right, that sock needs to be worn at all times. Why? Just think of it. It's protected. It's a protective cover. It's going to absorb the perspiration and absorb that moisture, because we know with increased moisture, we have increased skin breakdown. So that sock is going to absorb that moisture, that extra moisture, to prevent skin breakdown. All right, so that's why that sock must be worn at all times. And because it's absorbing up all that stink, we have to change it and wash it daily. Okay. And then the socket of the prosthesis, the actual prosthesis leg, the socket of it, that's washed with a mild detergent, not bleach or whatever harsh bactericidal agent that you can think of. But that's washed with a mild detergent and dried in carefully, and that's washed each day. All right, so make sure you know. Great. Those are our big takeaways. All right. Not yet. So much is coming. But I promise I got y'all. All right, this next year, definitely for the rest of 2021, y'all don't even know how much I got you all for the rest of 2021. It's going to be an insane rest of the year. But just know that if you are in nursing school, you need to be following me. You're going to regret it if you're not following me. I'm gonna just say that, okay? All right, next question. This one will be our last question for the night. And then, like I said, I'm gonna have this replay. It's gonna be up on my YouTube channel. And that's how you can be able to rewatch it. Okay. All right. Let's go. All right. The nurse is instructing a client with hypertension on the importance of choosing foods low in sodium. The nurse should teach the client to limit intake of which food? A, apples. B, bananas. 3, smoked sausage. Or 4, steamed vegetables. The nurse is instructing a client with hypertension on the importance of choosing foods that are low in sodium. The nurse should teach the client to limit intake of which food? A, apples. B, bananas. C, smoked sausage. Or D, steamed veggies. Do you think UWorld is great for NCLEX? I think UWorld is a great option, but as far as if it's a great option for you, I'm not sure, because it depends on your learning style. It depends on so much. So even though it's a great resource, we have a bunch of great resources out there. We got to figure out which one works for us, and not just go by popularity. Okay, if it's popular and it works, that's amazing, great, win-win for you. But just because it's popular doesn't mean it's gonna work for you. No shade, just saying. All right, so you guys are saying sausage, and that's correct. All right. Let me see who got sausage. So some call me Boo, Simply Shayla, Ivana, Ages World, Holloway Jasmine, A December to Remember. That reminds me of that Anastasia song. Once upon a December. Okay. Amaya, Koi Cash, Naturally Cam, Just the Best. I love these names. It's Dion. Did I say Koi Cash already? It's Dion, not Dion, period. Prigda. Hey, Dr. Registered Nurse, what's up? So great job, guys. If you said smoked sausage or number 3, that was correct. I'm trying so hard not to make a smoked sausage joke. I'm trying so hard, but I might fail. Who knows? Give me 2 minutes. Anyway, so correct. Smoked foods, whether it's sausage, a turkey leg, whatever. Smoked foods are just high in sodium. They're high in sodium. All right. So that is why that is the correct option. As far as the remaining options, the apples, bananas, and the steamed veggies, all those are low in sodium and great choices for this client, by the way. So not only are they nice and tasty and nutritious, but they're also low in sodium, which is the most important aspect of this particular question. We're not looking for, hey, what's nutritionally the best for you. We're looking for this specific food is high in sodium, and so I want you to stay away from it. We're not focused on what else is good for you. We're focused on what you need to stay away from. So when you go to Juicy Crab, Joe's Crab Shack, I don't know if Red Lobster puts sausage in their crabs and stuff like that, but if you go to a crab boil, young man or young lady, you need to skip the smoked sausage. You better ask for something else. First of all, you shouldn't be eating that if you got hypertension. But anyway, smoked sausage, smoked anyway, anything is high in sodium. So if you have a client with hypertension, a smoked sausage will not be the best choice as far as food. I know, I love those places too. Oh my God. I said Juicy Crab, and I really want one. I really want a bowl so bad. All right, guys. So that concludes our NCLEX Jeopardy for tonight. I just love our hours together when we spend time together on Thursdays and Tuesdays. I just feel like we just bond. Okay, we bond, we go over questions for the NCLEX, we laugh. I feel like it's just a great bonding moment, okay? So, if you guys want to come back and definitely see this replay, I'm going to have this replay up. If for some reason my YouTube hates me and it doesn't upload, I'll just upload this replay tomorrow to my IGTV while I get the YouTube thing figured out. So no matter what, this replay will be up either here or on IGTV. But I definitely what's today? I definitely want to let you guys know that the sign up is officially open for NCLEX Jeopardy next week. This is our real deal NCLEX Jeopardy. We're going to have the blue screen. You're going to see my face. I'm going to be in the corner. But you're going to be seeing the actual game screen of NCLEX Jeopardy. We're going to have our 5 categories, our 25 questions. We're going to be playing, for points. We're going to be playing for prizes. All right, so this is going to be next week on the 24th at 7 p.m. Eastern Standard Time. Go ahead and go to the link in my bio and scroll down just a little bit, and you'll see the sign up to register for the NCLEX Jeopardy on June 24th. Okay, this will be the big main NCLEX Jeopardy for the month. You do not want to miss this one. All right, so like I said, we're gonna be playing for prizes. Been playing for cash prizes, study kits, honestly so much, but that's the whole point of those things. We like to make it fun and competitive so that you guys can bring your A game. We can have fun while still learning how to pass and slay this NCLEX. All right, so like I said, make sure you go to the link it is free to register. All right, this is 100% free. This is just another webinar. It will probably it'll last longer than an hour. Usually these are about an hour, but the one next week's probably gonna be about closer to 2, to be honest. But like I said, we're playing for prizes, we're playing for education, information. All right, so thank you again for joining me tonight, and I will see you guys next week on our webinar for NCLEX Jeopardy. All right, and make sure that you guys get your NCLEX packets, your ultimate bundles, your ultimate nursing school bundles, formerly known as the ultimate NCLEX bundles. So yes, it's basically the same, but it has more information and it's organized different. So that's why it's a different name, but still the same content, just extra. Okay, we are now offering quad pay. So you can get those, you can get your bundle, study now, pay later. It's 4 interest-free payments so that you can utilize that if you need to. And for being on tonight, you guys can utilize code Dirty30. Dirty30 for 30% off whatever purchase that you guys want to make for the next, for tonight. All right, so that is my thank you for being here with me tonight during our review. Dirty30 is your 30% off coupon code. And then I will see you guys next week during our big main June finale for the NCLEX Jeopardy. All right, so make sure you go to the link in my bio, click sign up to register, and I will see y'all then tomorrow at 7.